Hello and welcome. I'm Marwan AbouRass. In this presentation, I aim to explain why cold pulp testing, CPT, remains the standard of care in pulp diagnostic procedures. It is simple, biologically valid, clinically reliable, and most importantly, it aligns with the way most patients describe their dental pain and their complaints about sensitivity to pain, hot and cold food and drinks. So the first goal of this presentation, or first objective, is to clarify the connection between CPT and the Brannenstrom hydrodynamic theories, 1963, which showed that applying stimuli on cut dentin disturbed the movement of the dentinal tubules fluids, leading to pain and sensitivity. This hydrodynamic theory has been confirmed over the past 60 years, and it is really considered the most reliable explanation for pulp responses to thermal, chemical, physical irritants. The second objective of the presentation is to share with you my experience, 50 years experience with the carbon dioxide, CO2 ice, or snow. In the presentation, I will detail the advantages and how I use it. Carbon dioxide ice has been used worldwide, as I said, for more than 60 years. It has been extensively studied. Liz Wannett in 2007 explained how it interacts with the tooth structure, the pulp chamber, the canals. The third goal or presentation is to discuss the cold refrigerant sprays, the dichlorourethane and the Freon, previously used, all these sprays and refrigerants, which are mostly used today. Globally, unfortunately, I see significant limitations in their use, especially in general dentistry clinic and hospitals. The cause of this may be lack of good and reliable clinical guidelines in their use when we do in teaching in the schools, especially regarding the risk of false positive. Many of the things we complained about EPT are happening now, the isolation problem, the spillover. There is a risk of a false positive with these refrigerant sprays due to the liquid leakage into the periodontal ligament, the gingiva, or adjacent teeth. And that's because of insufficient isolation. Additionally, the absence of a standardization stimulation point, exactly like what we had at EPT, where you apply the cotton. Some people say use small cotton. Others use soaked large cotton to cover the whole tooth. I don't understand. We need standardization. We need to avoid the false negatives and false positives. We must pay more attention to as I stated, to the broader context, okay? Don't rely on, cotton pellets, softened gutta percha, a zap with electricity to tell you what you're supposed to know biologically. Again and again, that will take me back to the stress pulp concept, you really need to understand pulp testing with the context of the story of the tooth, the history of the tooth, the story of the pulp. And that's what I call the STP, Stressed Pulp Test. It's biological, it's logical. You don't have to do anything, just think. Think biologically and act preventively. Thank you for listening.